Good afternoon, everyone. Thanks for patience and your attendance. I had a bit of a struggle translating the basics of ecosystem as defined in nature and bringing it to healthcare. To me, if you take any microcosm and look at all the components within that and see how they interact with each other and how they are dependent on each other, then I guess you've pretty much defined an ecosystem. In general, within healthcare, if we look at all the players, and I'm not going to read the slides out to you. If you look at the players in the healthcare system, central to this whole thing should be the patient, because ultimately what we want to do is provide safe and appropriate care to the patient. That's the fundamental goal for any provider in any part of the world. So because there are so many other players in the mix, and each player has his or her own different view of attaining that, and there's also a selfish motive within each player's agenda as to how to maximize their own existence and continuation of their existence in the system. That is inevitable. There are no villains in this. We should never look at it as somebody is trying to do something that goes against patient care. There are no villains. It's just that everyone is trying to look out for themselves. Now it becomes the challenge for the healthcare industry to balance all these different requirements and agendas and still achieve the ultimate goal of providing safe and appropriate care. That's the bottom line. So if we were to consider that and moving away from when the very basis of healthcare and patient care came up with the Hippocratic Oath and first do no harm. That's the basics of it. Well, if you don't aid in killing the patient, that's a good start. Is how we look at it. If we take the same fundamental requirement and then apply that, today we're talking about computer systems in healthcare. Yes, they would not eliminate all the medical errors that could take place, but they can minimize a lot of the errors. In the previous session, they were talking about drug-drug interaction and drug-to-patient interactions that can't be avoided. The system, the computer system, aids a lot in eliminating that kind of errors, but we cannot say that the system itself is the solution. The real problem occurs where hospitals or any business looks at the computer system as the end-all, fix-all solution. It is not. And in full disclosure, I represent eIndia software, which is a software vendor, and Backbone is our flagship product. So I do recognize that there's a lot of value added from any software or a computer system, but we need to understand that the computer system by itself is only a small part of the whole equation. And I just happen to like this quotation, and I just want to caution that unless you have a system in place, a computer system is of no use. Every organization has to have a system in place, which means that they have a process, procedure, and a formula that allows them to transact their business. And if we don't have that, the computer system doesn't do anything. It just adds to the price of operating this product. This is another interesting thing that I know on the internet. We have more hospitals that actually are still paper-based. There are hospitals that use computer systems which have not shifted to away from the paper-based systems as well in the delivery of service. There are many reasons for that. Physicians that don't want to sit in front of a computer, physicians that cannot afford to sit in front of a computer and enter all the data because they've got patients to see. So there are many reasons, there are many causes that lead up to it. But it is an inevitable fact that paper-based system is something that is very prevalent in most hospitals today. this kind of reflects pretty much the previous speaker's quotation of the statistic. I like it, but at the same time I have to also remind you that the US is probably one of the few countries, probably the only country that takes medical care to the most aggressive level. What would be written off as chronic and asked, the patient's family is asked to take the patient home where they can be comfortable. In the US, they keep the patient and try every possible aggressive procedure they can to try and prolong the life of the patient or diminish the effects of the disease. So, to me, it's a large number, but it should not be just taken out of context because they have the level of aggressiveness that we don't, and most of even European countries don't get to. It leaves us at a point where we are now required in the healthcare sector to adopt a proper approach to how we want to go ahead from here. If we are to recognize how much all these competing parties within the ecosystem of healthcare are acting on the system and where it has left us today, we have actually gotten to a point where we are actually forced to do something about it, which is not a good way to go about fixing anything. You really want to look ahead, plan, and have a solution on hand for things that you've already recognized. We have not done that, and to a large extent, the healthcare industry and the software vendors are both paying a price for that. If we just look at the goal, the chief goal of the players within the ecosystem, everyone agrees. There's no one that's going to disagree with this statement. The problem is how much empowerment do the physicians and the administrators today have to push this agenda? Everyone agrees, everyone talks about it, everyone says, yes, we have to do this. But again, we all have many agendas within our own little roles that we play. We all have our own agenda. And I have my own agenda in terms of the software provider. I have my own agenda. I'm not above the fray. The problem is we have not been able to come together and empower the actual people that can demand and require a proper approach to this whole thing. That has not happened yet. Forums like this are a very good start, but we're still way behind in actually adopting something that would bring us where we need to be. We're not there yet. And it's important that we recognize that as a handicap that we are currently facing. Everyone has talked about silos and how we can collaborate it and be able to function together. All these things are obviously problems that have been recognized. And I would hope that by the slides that I've shown so far, we've been able to actually talk about the provider-player relationship that the chair had brought up, and also the whole interaction within the stakeholders for any given hospital, how it's going to be handled. We also have to recognize the other item that he was talking about, which is how do you share the information between care settings? How portable is the data? How portable is the information? Understand how portable is this information? Back in 1991, on an assignment in Boston, I was working for a company as an IT director that owned about 11 hospitals across 4 states in New England. The problem was every hospital would fax a hard copy of all the information for the CEO's attention. What I did was create a central database and network all the 11 hospitals so the CEO could actually view all this information at one point. It was not a fancy application. It was actually, I did the designing and also built it on Paradox. If Probably there are people here that weren't even born when I finished my MBA. But this was a database application, which doesn't even exist for us. And I built a very simple application that gave access to the information that is needed at that point in 1991. The point behind this is not that we don't have the technology. It is not that we don't know how to do this. It is not that we are mired in all kinds of problems. We have all of them. What we lack is a single entity initiative to bring about this kind of adoption. There is not a single administrator in the hospital that doesn't wish for this. There isn't a single promoter that doesn't want to have it. Where we are lacking is a centralized and a approach to providing this kind of information, this kind of system. If you look at all the different problems, all kinds of issues that exist in any hospital, every hospital administrator faces these kinds of problems. They're aware of it and they're dealing with it on a day-to-day basis. I have personally know Mr. eHealth Padmanabhan, and I know enough of his background and of his and his approach in his administration to appreciate what he does on a daily basis. My point is, it's not necessary. It is not a lack of recognition. It is just a lack of motivation in the sector that we have not acted on. We all know clearly what the rewards are. There is no argument about how big the rewards are and how immediate the rewards are. Yet we have not acted on it. In terms of what kind of IT solutions, IT answers to these questions are already out there. These are some of the things. I don't have to go through each one of them. I can just give you how these different. Okay, the decompressor. I had a logo of that one and it didn't show up. This is what we have in AOSA's flagship. These are some of the things that we've already incorporated as a technology because we recognize that these things are needed to address the problems that we have. This is not actually, we have provided a capability to the patient's attendant to place an order for what they need from the canteen using a smartphone, using SMS, not even smartphone. You can just use the SMS. This is a platform. It is not to ridicule the use of technology. It is an illustration of what extent we can take this. And I wanted to show this because something that a person like eHealth Padmanabhan can recognize. And he's also fortunate because the chairman of the Dr. N.G. Palaniswamy returned from the U.S. in 1991, and he brought with him the same philosophy, the same approach of what he's seen, and has given UK the freedom to pursue his dreams and bring the technologies that people are talking about that KMCH has incorporated. We need more of these. We need more people that are at allow this level of technology. This is an example of a kiosk. It's an actual screenshot of the kiosk at the Case Hospital. The idea is the patient. They know what their balances. They can look up for therapy that because the patient family will require pieces like the weather, trains and hotels, cars. They are also allowed to do. They are given at their fingertips. This is a touch screen. At the fingertips, a whole lot of information. What happens? this better than everything. And the people that ask for these kinds of information at the information desk, there are things there. It allows the people in to function more with other things that they can actually do better, that bring patient care focus. That is what we. These are some of the capabilities that are already available to us. Now, if we say, well, where does it leave us? I have ahead of us. To me, the future is actually very bright and very good, because 5 to 7 years ago, the forums did not bring topics to the foreground. There weren't people that were willing to admit where they are, and we need help. It was not happening. But 62 years of post, we don't have another 50 years to. We are too slow in our progress. For me, the next 2 to 5 years, we are going to of healthcare any European, and we have the millions of people, Indian origin, abroad, bring exceptional. Why are we not able to? I have half my adult life in the U.S. to run this company. Love India, and that once this assignment is over, I want to create that allow me to retire here in this area. The reason is, out of all things that are in our hands, use them. We are using them for fraud because they are then we enable ourselves to